All right, now to some health news this morning. Enlarged prostate is a condition a lot of men deal with, but now there is a new minimally invasive treatment that can help. Dr. Jared Wallen is a urologist with Advent Health Tampa who specializes in this. Good morning, doctor. Glad to have you here this morning.
Thank you so much for having me.
So let's talk about this. Explain what this enlarged prostate, the complications that can come from it. And again, I mean, as I mentioned, very common. You're seeing a lot of this.
Yeah, it's very common. I mean, ultimately, unfortunately, the prostate is in an area, it's a reproductive organ, but it's in an area at the base of the bladder where men basically have to pee through a channel through the prostate. And as prostates grow, they basically kind of collapse that tube. It creates issues like urgency, frequency, slow stream, dribbling, having to get up at night. Is it something that happens over time? Is it something that... You know, it's typically more common in men that are over than 45.
Okay.
You know, ultimately, it's kind of an older man's disease to some extent. It certainly
but I don't know if it could come on, you know, pretty fast, or if this is something that...
Sometimes it can. Sometimes it can present to where someone has kind of some subclinical symptoms that they don't necessarily notice, or maybe they just brush off, and then the next thing they know, they can't pee at all, and they have to get a catheter in the emergency room. So that's certainly a more severe case.
So what has been the most common? We're going to talk about a new treatment this morning, but what has been kind of the standard up until just kind of recently?
You know, ultimately, first you always start with behavioral things, avoiding caffeine, nicotine, alcohol, spicy foods. Also, there's medications out like Flomax is one of the ones that's out there that's popular that can help kind of relax the muscles and allow urine to move through the tube a little easier. There's certainly also other surgeries out there. There's a transurethral resection of the inside of the prostate channel, or a little laser that can be used to kind of vaporize the tissue. There's multiple different things that can be done.
Okay. We're going to talk about one, though, right now, specific, that you said you're seeing a lot of great results. And the best part is there's no, I mean, it's an in-office procedure, essentially.
Yeah, so a lot of the older treatments that I mentioned before, the surgical procedures are done in the operating room with patients asleep. This new procedure that we're doing, Resume, is actually done in the office. That's not to say that we don't give any anesthesia, because we sedate the patients lightly and we numb them. But it's basically a small little camera that delivers some steam treatments to the inside channel. That basically kills the tissue, and then that opens up the channel.
Well, let's go ahead, because we actually have video that kind of shows how this works as well. Let's go ahead and take a look at this and narrate it for us so we can understand,
so you can see the prostate right below the base of the bladder, the little needle and camera slid into the channel. And you can see that the steam treatments are delivered to each side sequentially, directed by me. That kills the tissue in the inside channel, and then slowly over 4 to 12 weeks, that tissue reabsorbs and opens up a nice wide channel for patients to pee much easier through.
So in hearing that, it's not something that you get immediate relief from.
It all depends on your prostate. Ultimately, I've had patients who, as soon as we take out their catheter the next week, they've done much better than they were before. But for some of the bigger prostates, certainly it can take a little bit more time for that to evolve.
Anything that anybody should know about who would be the best candidate for this, or is it really?
I mean, certainly anybody who's having issues, as we mentioned before, the urination issues, anybody who wants to avoid general anesthesia, which certainly anesthesia is not without risk.
Yeah.
You know, ultimately, pretty much the gamut is open for almost all patients.
Good to hear.
Absolutely.
This is why you're having a seminar coming up tomorrow night, because again, I know a lot of people might have questions about this. Explain how this is going to work, and invite everybody out to this.
Absolutely. So we're having a free seminar Thursday, May 9th at Temple Terrace Country Club. Ultimately, everybody's welcome. There will be some refreshments, and I'll be available for a presentation as well as questions. Are you going to talk
about this specific procedure?
Exactly. The seminar is 100% geared towards Resume procedure and urination issues for men. Ultimately, I'll certainly be available for as many questions as folks have afterwards as well.
Do people need to register? Can they just show up? What would you recommend?
I think we have registration online, but they can also show up and register at the event as well.
Well, Doctor, we appreciate your time this morning. We know you are very busy. We appreciate that your team is putting on this seminar as well, this free seminar. We'll make sure and put details on our website as well. But thank you so much, Doctor.
Thank you. Appreciate it.
Free offer.